Hi everybody, my name is Stuart. I'm an orthopedic surgeon. I'm a fellowship trained, board certified orthopod doing hips and knees for about 35 years. And a very common question we get is, does a person who falls, hurts themselves on the job, did they have an aggravation of their knee when we know when we take an x-ray after the fall that they have arthritic changes in the knee joint? So we get the x-ray, it shows no fracture. Because if it was a fracture, well, that would be an aggravation, right? That makes sense. Or a dislocation, that makes sense. But if it's a knee that looks arthritic, no fracture process, is that an aggravation? Well, the only way you find out really is examine the knee joint. What we look for is someone has a swollen knee, not a contusion or ecchymosis on the outside, but a joint effusion. Effusion is joint fluid that accumulates as a post-traumatic response. There's an insult to the knee, and then the joint gets inflamed. When it gets inflamed, what happens? Joint accumulates. It's called the joint effusion. And we see that clinically. You can see it on examination. Range of motion may be decreased because of the joint effusion. MRI shows it really well. Not just a small joint fluid that's always there, but you see an MRI evidence of a joint effusion with synovitis. Synovitis means the synovium, the line around the joint, is somehow injured, traumatized, and as a response, it secretes fluid. That fluid is like a lubricant to the joint. So if we see those things, that's a problem. Also, if we see a knee that has other acute injuries, for instance, like an osteochondral injury, bone joint injury, cartilage injury inside the joint, a fracture perhaps, that's a real aggravation. So most aggravations of the knee joint arthritis, a common term we hear all the time from the attorneys and doctors, is that it's probably mostly a soft tissue injury superimposed upon the joint, which means that you have a bruise perhaps, a tendonitis, but not an aggravation of the underlying joint tissue. Very important to make that difference, because look, most people who have a fall-dead episode that strained to the ligaments, they get better within a few weeks. Put them on assistive devices, chemotherapy, anti-inflammatories, icing, they get better. Some people don't. Those people who have an ongoing aggravation are those that have progression of their arthritis because you've changed the ecology of the knee joint. And those people truly do have an aggravation. Those people I see do not. They just have a soft tissue injury superimposed upon a knee joint that's arthritic. Those are my thoughts.